I'd like to invite all of you to turn on your cameras. If you don't want to, that's fine. I also want to let you know that we'll be recording this event and it's transcribed as well. So if you don't want to be on camera, that's absolutely fine. If you would like to ask a question to one of our panelists today, it would be great if you could put it in the chat or raise your hand and we can call on you and get your question hopefully addressed. I would like to start out by inviting our panelists to introduce themselves, and so you can get a sense of who they are and what they do, and then we can connect from there. And Malik, you are first on my screen, so I'll start with you, if that's okay.
Sounds great. Hi, everyone. My name is Malik Mays. My pronouns are he, him, his. I graduated from Macalester in 2019. I'm currently a third-year medical student at the University of Toledo College of Medicine and Life Sciences. I am a rising, it's the last rotation of my third year, so I'm going my fourth year soon. I'm applying to obstetrics and gynecology for my residency. Thinking maybe going to gynec surgery or minimally invasive gynecologic surgery afterwards. So very excited about that. And I guess we'll get into all the rest of it later. Just happy to be here.
Thank you so much. Percy?
Hi, everyone. My name is Percy Griffin. I graduated from Macalester in 2013, and I hear you, Malik, graduated in 2019, and I'm like, wow, I'm old. I work at the Alzheimer's Association. I'm director of scientific engagement there. So working to try and achieve our vision of a world without Alzheimer's and all other dementia. So as director of scientific engagement, I engage with the over 75 different chapters all over the country. And in terms of coming up with and delivering presentations on education about Alzheimer's disease, and also working with the different scientists in the field. And my pronouns are he, him, his, and we can get into the rest later. I'm glad to be here.
Thank you. Shu?
Hi, everyone. My name is Shu Han, he, him, his. I graduated in 2010, so Percy, I got you beat on that one. So I studied chemistry, biochem at Macalester. I went to the University of Minnesota for dental school, and then I did a two-year residency specializing in pediatrics. So kind of what I do day to day is working with 3, 4, 5, 6-year-olds, getting them to cooperate to take good care of their teeth. And so we can talk more about that later, but I'm happy to be here and thank you for having me. So.
Thank you.
I mean, I'm up. Awesome. Hi, everyone. My name is Kate Jameson. I use the pronouns she, her. I graduated with Percy in 2013. I studied biology. I applied to med school. I had a quarter life crisis and was like, I don't know if this is what I want to do. So I went into healthcare consulting, and that kind of led me into the business side of healthcare. I got my MBA at the University of Minnesota. And since then, I have worked at United Health Group, which has two parts of the business. We have the health insurance and benefit side, and then we have all the technology side. So I've done a bunch of different stuff across the organization, but right now I lead technology teams to build software that helps our members live healthier lives. So that's a little bit about me. My husband is a PA. I should have gotten him on the call, but I can speak a little bit to the physician assistant process too. That's something that is more frequent now, but if you have any questions, I can kind of talk to that a little bit. Happy to be here.
Thank you so much to all of you for being here. So I will kick off the questions, just our conversation, by asking how each of you decided that this was what you wanted to pursue as a career. Sort of if you could tell the story or some factors that influenced your decision to go in this direction, that would be really helpful.
I can start because I kind of alluded to it a little bit in my intro. I was going down the med school path, and just to be honest, I was doing all the applications and was realizing what an investment, both in time and money, that would look like. And I was just like, I don't know if I'm 100% sure, and you have to be 100% sure. And so I said, I'll just take a year and I'll go work in a lab. I did scientific research at Mac and Professor Annenson's lab. I'll just do research and I'll come back to it and figure it out. And I went to the private college's career fair. I had no idea what United Health Group was. I went up, I was like, I like health. Hello, I'm Kate. And they asked, do you like finance or leadership? I was like, leadership. I did a bunch of like student government stuff, et cetera, at Mac. And I just kind of fell into it. And I always had the idea, like, I can always go back if I want. And I just ended up loving it. And I love it because I have such a big impact. We have 50 million members' lives in our hands, and every interaction across the healthcare system we can impact, from the financial side and insurance and making sure people can get the care they need, all the way up to like, we own clinics, we own, digital services, telehealth, et cetera. So I can play like up and down the system and work with people or work with technologies. So that's what keeps it interesting for me. And the impact is just so big, which I really appreciate.
I'll go next. So I studied biology and chemistry at Macalester. I was also going down the med school route. And then I discovered that I did research in Ron Brisbois' lab. So if you see him, say hi to him for me. And I realized that I really liked research after Mac. So in trying to kind of figure out what I wanted to do next, I did more research at the University of Minnesota in a Mac alums lab, actually. So I did 2 years of research there in Parkinson's, and then my third year, because I am an international student, I was like, hey, visa issues, hello. So I was like, I'm just gonna go back to school to get a master's. So I got my master's in pharmacology, and while I was doing my master's in pharmacology, I'm like, maybe I want to keep doing this. So then I went ahead and got my PhD at Washington University in St. Louis. And pretty early on in grad school, about like my second year or so, I decided that I did not want to go into academia. And so I wanted to do other things that will kind of prepare me for a career outside of academia. So I completed a science communication credential. I did some consulting. I worked in the Office of Technology Management. I was a writer. I was an illustrator. I did a whole lot of different things while I was in grad school. And when I graduated at, the most opportune time of July 2020, in the middle of the pandemic, I was trying to find a job, and I found a job in consulting. And sorry, Kate, but I realized that I really didn't like consulting.
I left it too. It's all good.
So I decided to make the career change into something else. And all of my research from right after I left Mac till after I finished my PhD was in dementia of some kind. So I was looking for jobs, and I saw this job here at the Alzheimer's Association. And I'd also done a little bit of introspection as to what I enjoyed doing while I was in grad school. So I realized that I really didn't like being at the bench, but what I enjoyed was getting some results, talking about the science, meeting new people, and traveling to do so. So it made sense that the director of scientific engagement who travels around the country to talk about the science would be the perfect job for me. So I applied for it, and here I am. And similar to Kate, you're capable of making such a huge impact in people's lives because it's such a devastating disease, and there are not really that many great options. So the fact that you can bring any amount of hope to people through the science is great. Someone thanks me for my job every day, and that's kind of a good feeling to have outside of, all of the other benefits. But so that's kind of how I got there. And I'll stop talking now.
I can go next. So I was a chemistry major with a biochemistry emphasis and a bio minor. So all the things. I was definitely went into Macalester, like similar to what Kay and Percy have said, on the med school path. And I think it was about my second year when I realized I did research with Dr. Whitus. She's amazing. I'm not sure if some of you know her. I did research in her lab for all 4 years at Macalester, and I wasn't sure if I wanted to. I really enjoyed research. I really enjoyed working in the lab and everything. So I wasn't sure if medical school was for me anymore. And so I think what really made a difference for me was I suggest to all of you who are interested in medicine, medical school, to get a shadowing experience of some sort, actually follow a physician, go to the office, go to the hospital, do something to really get firsthand experience in it. Because I think that experience for me solidified that I wanted to go to medical school. And like Kate said, it's a investment. It's a very expensive process. It's a very long process. And I guess my biggest piece of advice is don't do it unless you're ready. But when are you ever really ready to apply to something as big as medical school? And so I think for me, it was the perfect combination of the natural sciences and the social sciences, and talking to people and making them feel good, and even in their worst moments being there for them. And that was something I really couldn't get by being in the lab, that I was missing out on personally. And so I actually wanted to, I was thinking of taking a gap year until my shadowing experience, when it kind of convinced me, I want to do this now. So I talked to Liz Jansen, and we got my application together in time, and I applied right out of undergrad, which a lot of people call me crazy for that, but I guess it worked out. Yeah, that's kind of my process. There's a lot more that goes into that, but it's okay to not always know off the bat what you want to do. And you definitely don't have to be one of those people who knows from the first day of Macalester you want to go to med school. So if anyone's telling you that, they're lying. So there's never too late.
Thank you, Malik. So I was actually the same as you as far as majors. So chem, bio, going down that route. First of all, my parents were scientists. So like growing up, hearing them talk about acetyl-CoA and this and that is just kind of, I guess, grew me into going into the sciences on some level. I gave serious consideration to doing a PhD in chemistry. I just thoroughly enjoyed all my professors, everything that I learned. And ultimately what made me decide differently was just the shadowing experiences. I knew I could do the science, but I thought, well, why don't I shadow some physicians, some dentists, just different healthcare fields that was related to my major. And so what made me decide on dentistry was the combination of certainly the science part of things, but also the day-to-day, being able to communicate with people, being able to take care of people, but also the hands-on aspect. It is an art, and it is very technique sensitive as far as what I do. And I'm working with kids, right? So it's everything. It's like I'm working on a baby tooth. You go from this size to this size. And so being able to manage people, I'm the leader of my team, right? I've got staff members. I have to listen to them. So there's just so many different things that goes into it. And it plays to my strengths. And so I've really enjoyed this career. As far as kind of what I decided on, honestly, like my junior year is when I was like, okay, I need to figure out what I want to do. And it was just, everything kind of came together, decided that's what I want to do, applied, and it worked out. But as a general advice to all the students out there, I think it's important to know what you don't want to do too. Like you're like, okay, this is exactly, I'm sure I don't want to do these things. That helps you eliminate, right? Otherwise it can become paralysis by analysis, where you just have too many options. And also keep in mind that life is a winding road. It'll be rocky no matter which way you pick. And it is okay. Just surround yourself with strong mentors, find people that you admire. And believe it or not, all those people have gone through struggles and hard things. And so don't be afraid to do things just because it's hard. Just keep at it. And yeah, that's about it.
Thank you so much. We are open for questions. If you have any, please feel free to put it in the chat or raise your hand or direct message me. And I have another question to ask the group if you're still thinking. So maybe I'll do that while you're coming up with your questions. I would like to know if you could speak to how you think a liberal arts degree has set you up on your career path. Like what have you noticed about your liberal arts degree and the impact that it's had on your choices or your profession at this point?
I can, oh, sorry.
No, go for it. I just didn't want to be first again. I'll go after
No,
you.
you're good. Yeah, when I was picking undergrad schools, I really wanted to pick a liberal arts school because I knew that if I could, I would just take chemistry classes and I would just do chemistry and biology. And the beauty of Macalester, and sometimes the annoying part is that they make you do things in all sorts of places. So I actually remember my first year course, I really wanted Gen Chem. And then I was like, I have to go to med school. My first year course has to be general chemistry so I can stay on my med school track. I ended up getting my first year course was in, it was an American Studies class in race and racism in America. And I've never had a class like that. I never was able to even talk about race really before coming to Macalester. I went to a predominantly white all boys school in Ohio that really wasn't about those kind of topics. And I think just that class and the classes afterwards outside of the sciences really was the beauty of Macalester, making you talk about topics that affect everyday life outside of necessarily the natural sciences. I think understanding more about your interests outside of what you're studying all the time is good for your own personal development, providing yourself space to be well. I think the biggest thing in medical school that I've had to be more intentional about is finding the avenues outside of medicine to maintain my own wellness. And I think I wouldn't have been able to find those things if it wasn't for the opportunities Macalester presented outside of chemistry, whether it was in Glee Club or singing in Glee Club or doing poetry or taking a world music class or things like that, or being involved as a tutor, all those things. So, and I think one of the biggest skills that I grew at Macalester was my ability to communicate with people and have very tough conversations. As we all know, Macalester is a place full of ideas where there are many heated conversations and debates, whether it's in class or in the dorms or during lunch or dinner, what have you. And so I think being able to learn how to meet people where they're at, whether they agree with you or not, is something you don't get everywhere. And it's something that I have to be good at every day in the hospital, in clinic. I've definitely had situations where people don't want me there or are not the most kind people, but whether they're your patients, whether it's your attending, whether it's just a colleague of yours, I feel like every day I'm using skills I learned in Macalester to progress as a future physician and just in the space, my professional arena right now. So it's kind of a long-winded answer to all of that.
That was a beautiful answer. And I would echo a lot around sort of the emotional intelligence, having difficult conversations, communicating with a diverse set of people, backgrounds, viewpoints. I work at an international company. There's 350,000 people at the company. And so you run across people with different opinions, different, backgrounds, et cetera, every day, different styles of communicating and working. A couple other things I would say is a comfort with ambiguity, because you are thrown into new ideas, new classes, like you have to step outside your comfort zone. And I do that every day at work. And I think also fostering sort of a natural curiosity has helped me a lot at work as well, because you're always kind of asking the deeper questions or the question behind the question. And then the last thing I was thinking about is helping connect disparate dots or sort of see patterns and synthesize them and then communicate them back. Because I think at Macalester, a lot of what we were taught to do is see the bigger picture, bring it into a focal point and then communicate it well. And that's something that has been a strength at my company.
And I can go next. Very closely related to what Kate said. Having that liberal arts education has been really useful in terms of teaching me to integrate different ideas and different viewpoints to answer the same question. Because we tend to get kind of pigeonholed into silos of, hey, this is a chemistry question, or hey, this is a physics question, or hey, this belongs in this field and that field. But currently in my job, I work with so many different stakeholders, right? You're talking about the people dealing with the disease who have no idea what's going on in science, all the way up to policymakers who need to make decisions that influence the lives of millions of people. So you need to be able to first integrate all those viewpoints, and having a liberal arts education really helped with that. And also similar to what Kate said, it just made me more bold, just trying to stepping into an arena where you don't really have experience yet, but you still believe that you can provide some value based on the experiences that you have and the fact that you've done it before at Macalester. But I never took like a poetry class before I went to Macalester, or a geography class. As just like Malik, I would have taken biology and chemistry classes all day if Macalester didn't make me take other classes. But that endowed you with a certain kind of boldness that allows you to become a utility, an asset to pretty much whoever you work with. So it doesn't matter whether I'm working like in media, I'm working in policy, or I'm working with people living with the disease. You are able to talk to them in a way that they can understand.
Thank you. I would echo the same sentiment, and I think students, as you guys can see, it's Macalester prepares you academically very well. It's rigorous. I didn't realize how hard Macalester was. Well, I knew Macalester was hard, but once I got to dental school is when I was like, whoa, I had more credits per semester, but it actually seemed easier compared to Macalester, a lot easier. So I think when you reflect back, you realize, okay, you've had a really rigorous education, which prepares you for the next step. But more so, as you can hear from the other panelists, it's about preparing you for life, preparing you how to interact with people, how to lead, how to communicate properly. In my job, I talk to parents and families from all walks of life, and I have to be able to connect with them in a genuine way. I have to, and on an emotional level, I can sense when a kid is anxious. I can sense when a parent is anxious, setting expectations, communicating, and delivering that message concisely, right? So it's the big picture stuff you learn in Macalester, whether you're having lunch with somebody or sitting in a classroom debating in philosophy, right? So just soak it all in. I think fondly back on my Macalester times, and it's been so many years actually, but it's genuinely, it's such a good education that you're getting. It'll prepare you well for life, so.
Thank you. We do have a couple questions in the chat. One of them is for those of you who deal with patients. So the question is wondering what patient experience, jobs, or volunteering positions you had before going to medical or dentistry school. So maybe for Malik and Shu.
Go ahead, Malik.
Oh yeah, I think I actually feel like I had a limited experience necessarily. I think like working with patients and everything prior to medical school, compared to some of my colleagues who applied as well. I'm not sure if they're still doing it. I did the Taylor Shadowing Fellowship. I'm not sure they're still doing that. I'm seeing that. So yes, it was a really great experience. It was even if you don't know about it, I believe it was a summer before my junior year where basically you just meet with Dr. Jansen, and she gives you a list of MAC alums who have different clinics. I shot a colorectal surgeon a few times. I shot a pediatrician, a few pediatricians. I shot a neurosurgeon. It was a really great experience to see if medicine was for me, and so whether it's volunteering at the Children's Hospital, whether it's volunteering at a free clinic. I know I've mentored some current Macalester students who've done those kinds of things. Just find anything that deals with medicine and patient care, whether it's even being an EMT on campus, anything that can kind of get you in that realm. And I feel, I feel like it was a big thing when I was an undergrad, but there's nothing wrong with just sending a cold email. I'm telling you, just send someone an email like, "Hi, I'm a junior at Macalester or sophomore at Macalester. I'm interested in medicine. Can I shadow you?" You'll be surprised how easy it is to get in contact with people, how much we just want to hear from Macalester students, and like, "Oh, I would love for you to come to my clinic." I actually feel like the Taylor Shadowing Fellowship was great, but there's a lot of things I could have just done on my own in terms of going to the Career Advisement Center and saying, "Do you have a list of MAC alums in my hometown here in medicine?" They'll give you that list. And you just reach out to them. I'm sure a lot of them want to hear from you, and just be very intentional about those things. So I would say before you apply to medical school or apply to dental school or anything where you have patient interaction, you should really try to get some experience beforehand, because like Kate said, it's an investment. It's an investment. It's taking the MCAT at a certain time. It's paying for it's cost a lot of money to apply. We won't get into that. If you want to know about that process, that's another call. But it costs a lot of money to apply to medical school. And I think you want to know it's what you want to do, because there are a lot of ways to get into medicine, as you can see, without necessarily going to medical school. I think that was also something I didn't really understand as much going to Macalester, is that you don't have to be a doctor. You don't have to be a PA. You don't have to be a nurse. You don't have to do all, I guess, the standard things I thought of first when I thought of medicine. So just see what's out there. I hope that answers the question kind of a little bit, but yeah.
Thanks, Malik. So I also did the Taylor Fellowship, and I'm very appreciative of it, but I also want to emphasize that you do not need to. You can call up anybody, and I'm on the call. Like my roommates at Mac, one is an OB guy, and one is a family med physician, one is an internist. Like I can connect you with people, or Malik can connect you with people. Kate knows a PA, so so use your resources at Macalester. Ask the professor. I shadowed my current boss, who is a root canal specialist. I'm part of a multi-specialty group practice, but yeah, Liz Jansen happens to know him really well, and she's like, "Yeah, I know this guy. You should go shadow." And so it's just if you're tentative, ask the faculty. If you're just bold about it, just call somebody up in a department that you want to learn more about. But definitely do your homework. The more you know, the more prepared you are, the better decision you can make. And then also, I would say don't just shadow people that are in mid-career or starting their career. Shadow people that are in process, right? Shadow a medical student. I had a Mac student shadow me while I was in dental school. She came with me to class for a day. Okay, people are like, "Who is this person?" I kind of had to go into that story, but I think it's cool to see, like, okay, you might like what a family physician does, but will you like 4 years of medical school or dental school, right? Like, do you know the process that it takes, the amount of studying and all those things? And I think it's good to just really prepare yourself, but definitely do the shadowing and utilize your alumni resources. We're all here to help you, and we're happy to just point you in the right direction if we can't help you ourselves.
Yeah, I can jump in. I'm obviously don't deal with patients, but my husband decided to go to PA school after graduating. So he did biology, but didn't do the whole package right during school. He did a year of phlebotomy work at HCMC in Minneapolis, which is really what solidified medicine for him. It was not glamorous. It was hard. It was early hours, but he was actually like drawing blood from patients in the ER, and you had to really learn how to work with difficult patients, how to get them to cooperate, how to explain what's going on, how to work with family members. And there was no like real training or licensure. Like they give you like 2 days of training and they're like, okay, go. But that might be something if you're not like wanting to do a big certification or have to get this whole thing. That's kind of an easy way to get into a hospital and actually start taking care of patients.
So I'm gonna jump in real quick, not necessarily relating to patients, but something that everyone here has said already that I just want to reiterate is the value of just reaching out to people, especially now that recruiters, whether it was people in the hospital or still going to the hospital, but everyone is at home. Everyone is so connected to their devices right now. Like if you texted me right now, it will beep on my watch and I will see it. So if I've not responded, it's just me ignoring you. I was in a meeting. So you should truly just reach out to people because people do want to talk to you. There is an unspoken value of being extroverted that we don't emphasize enough. Just go for it. You've got everything to gain and nothing to lose apart from the 20 seconds it'll take you to type the email and hit send. Please check for typos. We don't appreciate those, but just go for it. Ask people, hey, do you have 10 minutes to talk? Hey, you don't even have to ask about like specifically shadowing or a job or anything. It's just trying to build that network, because if a position opens up randomly, they're like, oh, hey, there's this Macalester student who's interested in this particular area, then they can recommend you. They're not going to know that if you don't reach out and talk to them. So that's something that I want everyone to take away from here is just reach out to people, fire out those emails. If they don't respond, they don't respond. You haven't lost anything.
I also wanted to add, I feel like I felt a lot of pressure to go right into medical school after undergrad. I don't know if anyone feels that way, but don't. Please do not. There's so much time. And I think, yes, I was ready for medical school, but at the same time, it would have been nice to take a break at the same time to not be in school for at least a year, and wherever you want to do, if it's worth it, 1 year, 2 years to be ready is not going to make a difference. And if anything, it will give you more experiences to be more prepared for the opportunities that are coming for you. I know I have a friend who, he was a year above me at Macalester. He actually got to the MCAT and took the MCAT and then voided it because he knew it wasn't going to be good. And he took 2 gap years to study for the MCAT. And now he's at one of the top medical schools in the country right now, or there are people in my medical school who's in my class, they started when they were 45. They have a PhD and I think it was like English or literature of some sort, but they realized medicine was their path and now they're on the way to be a doctor. There's time. I felt like there was this rush to know my career very soon. Some of that was self-inflicted, but there's time. So don't feel rushed to find out that thing right now. I just want to put that out there as well.
Great. Thank you so much. We have the questions are rolling in on the chat here. I'm just going to read this one. It says, how have you dealt with difficult social interaction with colleagues, patients? What unsaid social emotional rules are there in the healthcare industry and in networking? What's the worst mistake one can make?
Well, I don't deal with patients, but I don't know that there's the worst mistake. Everybody makes mistakes. I mean, of course, if a patient dies and that's your fault, that's a different thing. But in my world, it's like you make a mistake, you move on, you learn from it, and hopefully you don't make the same mistake twice. That's what I would say to that one.
Recognize that everyone is human. You're human, they're human. We're all allowed to make mistakes. I think it's, if you do make a mistake, you own up to it, you're genuine about it. And recognizing that other people could have had a bad day, like they could have been rude to me, but I don't know what was going on in their life, right? For me to respond rudely back would be poor judgment, right? I think, especially when you're in a leadership role, you have to practice more restraint on some level and just think before you say something, right? So as far as just dealing with people, everybody's human. Some people just need more time. Like, I'm managing my staff. One is very vocal, one isn't. And so I know who needs more attention, or as a parent that's really on my case about the kids' care, recognizing patterns and then giving people space. So it's it comes with time. So I guess the main advice would be to just know that it's okay. Don't be afraid to fail. Don't be afraid to make a mistake. If you state your positive intentions, you can solve any issues.
In terms of the networking question, one thing that we're not told enough, we're told to have mentors, but one thing that we're not told enough is to be very intentional as to what you want from a mentor. No one is going to be your mom or your dad. Like, they're not going to mentor you in everything. You need to be like, hey, I really need mentorship on career, or I need mentorship in this, like getting this grant, or I need mentorship for this particular thing, because people are busy. People don't have like that much bandwidth. So if you're very specific, they're more likely to be like, oh, these are the resources that I have that can help you get where you need to go. And you need to think of it as them helping you get where you need to go versus them taking care of you for the rest of your career. That may or may not come, but you want to be very intentional about what you're asking for from people, because again, they can only do so much for you. So that's something to think about when you're thinking about mentorship. So that's why you probably should have a lot of different mentors. So not just one mentor who you depend on for everything.
I'm gonna hit a couple questions. I'll see the question in the chat. That would be good to hit. Good tip about mentors. You have to, sometimes be persistent. It's like hard to be persistent. It's like a line between being persistent and annoying. I know, like, when I've reached out to attendings, because I'm applying for residency soon, right? So I'm reaching out to different program directors across the country, like, hey, I'm interested in going to OB-GYN. Can we talk about your program? Blah, 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 blah. But they're also very busy, and even if they don't get back to you, doesn't mean they don't want to talk to you. They're also busy. So I usually, if I give about 2 weeks, I'll just send them the exact same email again. And there have been many times when the second time I send the email, like, oh my God, I totally forgot. I would love to talk to you. And it's just things like that. You have to be persistent in that way. And like Percy was saying, I have many mentors from Macalester I still talk to, mentors from high school I still talk to. I have many mentors, whether it's for professional development, whether it's for applying for residency, whether it's just for wellness, and things like that. I saw a question in the chat about wellness, overworked, underappreciated, extreme stress, and mental health. Yeah, and residency. So I would say, I think it was something that I thought sounded simple when I was in undergrad, of like just knowing your why. And I think that's a big reason why I chose medicine. I think for a while, from like middle school until my junior year in college, it was like, I like science and I like to help people. So I wanted to do medical school. And while I was progressing through and getting closer to applying, like, I could be in a lab and like science and want to help people. There are so many things you can do. So again, being very intentional about realizing what you like, what you don't like, and realizing if it is medicine, then you just have to be fully invested in that and know why you're there. I think I'm not going to lie and tell you that medical school is never going to be stressful and it's never going to be hard and you're never going to want to not do it anymore. However, I there are many times when I'm working with patients where I see a Black patient who just appreciates so much that I'm there in the room as well. You know, it's not a secret that there aren't many Black men in medicine, and in the hospital when I'm talking to predominantly Black patients, and we connect in that way, and they see me and they know I'm there to take care of them, they really appreciate it. It makes their day. Or when a patient tells me how great it was to just have someone listen to them, those moments make up for a lot of the negatives. And it's hard to talk about all of that, and like there's never like a perfect balance. But no matter what you do, if it's worth it, it's going to be hard. You know, there's going to be a stumble, there's going to be challenges. I've had many challenges applying to medical school, in medical school. I'm sure I have many challenges in residency and as an attending. So, and that's what I think it comes to, having mentors who are going to have those very honest conversations with you about how hard it is to maintain your mental health in medical school. You know, it is a daily challenge to be well, but you also need to be well in order to continue through it. So I'm happy to talk to anyone about that separately. I could talk about this literally for days, but just know why you're doing what you're doing, you know? And if you feel like your reason for doing it can apply to so many different things, that might be a sign to do a little bit more research on what exactly is right for you in that path.
Thank you. We've got a couple more questions here too. One person is wondering if any of you, or maybe even anyone you know, did not get into graduate school or medical school the first application cycle, and if so, how to spend your time before reapplying. Anybody have an answer?
Yeah, so one of my classmates in dental school, he was 3 years ahead of me in Mac. And so I didn't know him while we were attending Mac together for like, where we overlapped a year. He is an incredibly bright student. He did better than me in dental school, but it took him 3 years to get in, right? I think sometimes we can beat ourselves up about, oh, why maybe I could have done slightly better on a test or had a slightly higher GPA. But sometimes it's not about that, dude. You know, a school is looking for students of all backgrounds. And so if they've met what they needed, they may just not take you because they didn't have a spot for a different reason than you thought. So as far as what to do in the meantime, do things that are meaningful. Do things that are going to help. If you think truly grades and test scores are things that mattered in you not getting in, then you should work on those. In addition to volunteering or doing something that's related to the field that you're trying to get into, because that shows interest and that shows persistence. So when somebody does interview a couple of years down the road, they want to ask you, hey, what did you do with your time? And if you say, oh, I just chilled, that doesn't sound good. That doesn't come across well. So be intentional, and then again, seek out mentors and find something meaningful to do.
Something else that's very important is making sure that you get another set of eyes on your applications, because you've probably looked at those essays, whatever else, like 1,000 times, and you might not notice like certain glaring issues that are right there. So having another set of eyes on your applications is important. And as everyone else has said, don't beat yourself up, because we don't really take into account the importance of just timing. Like, so right now I'm on the other side because the Alzheimer's Association gives a lot of grants to people. So I get to see all of these incredible applications, and I'm like, it's insane that this person didn't get this grant, but if they had applied 2 years ago, they probably would have. Right? Not because their application was bad, it's just the timing was off. So again, give yourself some grace and make sure other people see what you're working on, and just be kind to yourself. That's something else that you need to remember. Like it'll happen when it's supposed to happen, as superstitious as that sounds coming from a scientist.
And I do think quickly, if you didn't get in and you have a reaction that is maybe relief or maybe curiosity about something else, like it's okay to not apply. Like maybe that's also, you get a feeling about it and that tells you something too, because that's what I did. Well, and I don't, does Shu or Malik, is it ever appropriate just to like email admissions and ask if there was something you could do when you reapply to be a stronger candidate? I don't know what that recommendation is, but like if I haven't gotten a job, I've asked why. Is that common?
I know people that have, like, I was advising them and they applied and didn't get in, and they emailed the admissions director and they didn't get a response. So I
Okay,
think it
that's
just
fair.
depends. Yeah, sometimes you get a response. I think
Big
it's worth
programs, maybe. Yeah.
asking.
Yeah, I think it depends. I put a message in the group chat. And yeah, like just first of all, I will again I'll give my email after this. I'm always happy to talk to students. It's a nice break sometimes from studying all the time. If you're interested and want to talk more. But yeah, be very intentional about the reason it maybe not didn't work out the first time. Like I was saying, like whether it's MCAT, taking a year to work on the MCAT. I know it's I'm definitely not a big fan of standardized testing. Trust me, it's not a good time, but it does matter. It does affect if you can get into a lot of these programs sometimes. And it's a screening tool they use. Or if you feel like you don't have the best GPA, there are ways to, with a master's program or a post-bac program. If you feel like you haven't got a good clinical experience, there are so many things you can do to get clinical experience and get paid. We're trying to make money at a certain point, and so I think that's no secret either. It's okay to be like, I want to make money. I'd rather make money before going to medical school, to pay for applying to medical school. I was not working during Macalester out. Like I didn't have a job. I worked as a tutor or something like that, but sometimes you need to make money to apply to these programs. And so if there's a clear weakness in your application, spending your time outside of school not focusing on that is almost doing yourself a disservice if you plan on reapplying. And sometimes you gotta face the hard truth, like I need to put in this time to do better on this thing for later on. And have people look at your application when it comes to personal statements or it comes to how your CV looks. I guess a plug for the Career Center, like go there, have them read your CV. There's just so many things you don't notice. And it's very good for someone like, this doesn't make sense whatsoever. Can you rephrase it, please? And so I'm telling you, it will make the world of a difference. So that would be my advice if you have to reapply.
And maybe also interview prep too. And there are coaches you can get. I know Career Center has them too, but you can get coaches specific for like the MMI format, for example. If it's a different format than you're used to, or you're not a good interviewer, like that is a skill you can learn. So put that out there.
Great. I have one more question in the chat, and before I ask that, I just, with all the talk about networking and reaching out, I would invite our panelists, if you would be willing to put your contact information, if you could drop that in the chat, or maybe your LinkedIn, that would be really, really helpful. And if you're okay with students reaching out to you for follow-up questions or further connections, let us know. The final question that I see is for Kate specifically. This person is wondering if you could speak a bit more about working in such a large organization, and if you ever feel like you're just a cog in a machine. And of course, if anyone else has thoughts about this too.
Yeah, and Percy's in a big org too, so feel free to jump in. It's a double-edged sword. I mean, we have so much money to make change. There's so many people to help impact that change. But it can be hard to navigate. I mean, you have to have a lot of intuition, and this is the business side. This is not just going to be, this will be also in If you're in a healthcare profession, you are also in a business. So you need to understand the cycles of how things work and how the business operates. You need to understand like the power dynamics in an organization, who makes decisions, how do things get funded, like how does it work? You're going to need to know that regardless. It's just harder in a bigger organization because you can't be everywhere at once. So I do that through my networks. We've talked about it a ton, but I have friends all across the organization who will tell me the gossip, you know, who's leaving, who's moving, who's doing this. And it's a fun way to catch up, but it's also really important because then I know how to navigate the org. Also have had like 5 jobs in, you know, 10 years across the organization. And I highly advocate, like, if you are in a big org, moving roles and trying out different things, because you learn different skill sets and you meet different people. Do I feel like a cog in a wheel? Not really. I mean, I lead a big team. I have a lot of agency. I control a lot of my own destiny. And so, yes, there's certain things that kind of get in the way, but if you have kind of, you assume positive intent. I think Shu, you kind of said that earlier about like people are trying to get their work done. So how can I make my work their work, right? So how can I leverage people to all, you know, come together? And that's a skill that I've learned, but it makes it feel like less bureaucracy. I don't know, Percy, any extra tips?
Yeah, so I'm in a big organization, but there are about 10 scientists with PhDs at the organization. So I get a lot of visibility on what the strategy is that is being implemented. And at the end of the day, right, no matter the size of the organization, every organization has an agenda, right? Whether it's making money, whether most places want to make money, whether it's helping people, you want to ask yourself whether or not you're comfortable with the agenda in terms of what you're doing day to day, right? Like I'm okay with it because I love the mission. The mission is important to me. That's why I do what I do every day, right? But you need to ask yourself that because unless you're starting your own business, you're going to have some constraints. No matter, and even if you start your own business, you're going to have
We have more constraints.
answer to the board.
Yeah.
So no matter where you go, there's someone that you're going to answer to. Does that make you a cog in the machine? Not necessarily. You just have to be willing to I don't know what the words I'm looking for. Just be okay with the agenda as it is, because it advances both your interests and the interests of the organization. That's
Yeah.
that's the best advice I'll give. You're not a cog. You're a driver of change. How about that?
Yeah.
For a change in perspective.
I love that, Percy. And sometimes I think of myself, maybe this is like a different analogy, but I'm almost like a little rock in a river. And whenever I've hit a no, I like find a different path. And I'm like, okay, but I still want to do this thing. So how am I gonna go around it? And even like graduating and taking this role with Optum United, it's all about the process of just saying yes to something, right? Just take a shot, say yes. Okay, that didn't work. All right, I'm going to go over here. Oh, that didn't work. I'm going to go over here. And that's just kind of also how I navigate the organization. And I just like figure out ways to make it happen and bringing people along and building a coalition. So it's not like a fight. It's, hey, let's all do the same thing together. We all have the same vision. So I like that thought, Percy, about sort of making sure you're aligned with the mission of the organization. Plus, we get to travel a lot more when you're in part of a big organization. You can go to Brazil and Chile and the UK. Well, maybe not now, but there are perks.
There are perks.
They'll pay for your hotel, massive hotel points.
Well, I feel like this conversation could go on for a long time. We have a lot to talk about, but I want to be mindful of the time and really, really just express our gratitude to our alumni panelists for being here. I've learned a lot from you. I hope the students have as well. And just want to tell you students that you'll get a follow-up email after this event that includes some of these details, including the contact info that our panelists shared with you. And this recording will be shared at a later date too. So if you know people who missed, who couldn't attend, it can be shared out in that way as well. So yes, thank you so much, all of you, for being here. And we will hopefully all be in touch with our networks.
Sounds good. Have a great rest of the week.
All right, bye-bye now.
Great.
Bye,
Rest of
guys.
your evening.
Bye. See ya.
Bye.